Hello.
Hello,
Hi.
hello, doctor. So
Hi. How are you?
I'm good. I'm good. Friend,
Yeah.
she's Dr. Prevenna Chakaravarthy. She's a senior orthodontist in Clove Dental. और आज हम इनके साथ हमारी सारी क्वायरीज डिस्कस करेंगे जो भी हैं बिकॉज ये एक बहुत इंपॉर्टेंट टॉपिक है जो मतलब हम लोग अवॉइड कर देते हैं मतलब वी टेक केयर ऑफ आवर किड्स बट वी अवॉइड ओरल हेल्थ सो ऑन ओकेजन ऑफ वर्ल्ड ओरल हेल्थ डे मैंने सोचा ग्लोब डेंटल के साथ हम कनेक्ट करते हैं और आपके लिए एक बहुत यूजफुल सेशन करते हैं सो डॉक्टर शैल वी स्टार्ट
Yes, we shall start.
सो प्लीज आप पहले कुछ थोड़ा बताइए व्हाट एग्जैक्टली इज द व्हाट्स द टॉपिक ऑफ टुडे व्हिच वी विल डिस्कस
Yes. So I'm Dr. Praveena. I'm working with Cloud Dental for past 6 years. I'm a senior orthodontist over here. So today we are going to give some awareness to the parents because most of the parents come to us asking for what age is the right age for my kid to start the treatment. That is the query. So we thought we'll clear up all the doubts, whatever is there regarding the age. The problem with the kids, you know that adults wear braces, that is fine. But some parents are very worried when the kid is very small and they don't know what to do with their teeth and stuff. So that is the reason we are here now to help them and clear their doubts.
यस सो आज मेरे को काफी सारे क्वेरीज आए थे व्हेन आई पोस्टेड अ स्टोरी मैं वहीं से आपसे स्टार्ट करती हूँ आई हैव नोटेड डाउन ऑल द क्वेश्चंस जो मेरा को सबसे पहला क्वेश्चन आया था वो ये था कि what will happen if I don't correct my child's irregular teeth?
Okay, so there are when it comes to a kid who is growing, most of the parents what they miss is they just see only the teeth portion. The teeth is irregular, or it is forwardly placed, or it's backwardly placed. That is their only concern. But what we generally miss out is the jaws. The teeth is not the only portion of the face. The jaw is also a part of the face which we deal with. Okay, basically the orthodontist us, we deal with that portion of the teeth also. Okay, when the in the parent's eyes or anybody who is outside the dentistry, their eyes, they can see only the teeth portion of it. We miss the jaw portion. So we are sure to see whether the problem is in the jaw or in the teeth, for which you need a dental visit. I would advise to start a dental visit at the age of 6. When your
Okay.
child is 6 years, that is the first right age to bring because in the sixth age, on the age of 6, being a mom, we understand that the teeth keep falling. The first teeth to fall will be at the age of 6. So when you bring it in that particular stage and you have a regular checkup with us every 6 months or once in a year, we'll be able to find out whether the problem is with the jaw or with the teeth. Depending upon that, we can suggest. See, a child will grow only up to 13 or 16 or 19 years. After that, the growth of the face and the jaw generally stops. Maximum 90 to 99% of growth stops. So mostly we'll have to catch hold of the growth to correct the jaw and the face also. That's necessary.
Okay, so useful information you are sharing with us. The second question, which is my child permanent teeth are coming and they are so big. He looks like a bunny rabbit. What do we do in such scenario?
Yes. As I answered previously, every some 6 years you should have a regular follow-up, though you have a problem or don't have a problem. Basically, why our teeth looks like a bunny teeth is because the first teeth to erupt is the front teeth, especially
Yes.
in the upper jaw. Right? When the teeth fall, when you see the kids, they will have a small hole and when they smile in the kids. So that is the first thing that is visible. So there are two types of teeth, two types of dentition, which is a milk tooth and a permanent tooth. Correct? So milk tooth are very, very small. So when a permanent teeth erupts, it is comparatively bigger in size. So for our eyes, it will look like a bunny teeth. Okay, so if
Okay.
you bring it to us, the orthodontist, we can see and assess, as I told you before, the regular follow-ups. We should see if an intervention of braces is needed or any appliance is needed or not. and then we'll take a call. It is not a common scenario for everyone. Yeah.
Okay, okay, doctor. What are the best ways to correct my child teeth, and who is the better to handle these treatments?
Yes. As I told you, we have various specialities with Clove Dental. Clove Dental has about 340 clinics, and we have all the specialities with us who are really experienced. So when you bring the child, we have multiple specialities. The one who handles with kid is called as a periodontist. Okay, and one who handles with the braces is called as an orthodontist. So we can do it with either of them. Either a periodontist might be required for a child, or an orthodontist can be required for a child. So once you bring the clinic doctor, whoever you up to, they will put that to a particular specialist who can help the child to correct the problem.
Okay, doctor. Can I think ये question I have asked already. Can irregular teeth be prevented? What should I do so that my child gets beautiful and even teeth?
Yes. See, there are various ways in doing a treatment. First is the prevention. Prevention is not making the problem to come. Okay, preventing even before a problem comes is a preventive stage. As I told you, when you bring the child to us, we can see if we can prevent the problem which is there in future. Or if you miss the age, say you bring the child to us about in 9 to 12 years, if the already the prevention stage is gone, there is something called as the interceptive stage, where even before the child is mature, some problem occurs, we can intervene in between and we can make it more simpler than correcting it after the problem comes. Okay, this is an interceptive stage. And the third stage is the permanent dentition stage, where the orthodontist will directly deal it correct. These three stages are there. So when you bring your child from about 6 years, we'll access of which stage the child is and which specialty will handle with the child.
Okay, so good to know this. Are there any side effects of braces treatment in kids? Because parents थोड़े डरते हैं early age पर braces लगवाने से. So is there any side effects?
Actually, side effects are such there is nothing. When you wear a braces, it has to be maintained properly. Teeth brushing is a problem, you know, right? So if they are not able to brush their own teeth, it's difficult for them to brush the teeth which has got some appliance. So this needs some extra care, which we will be telling them of how to maintain, how to brush and all that. We'll do regular follow-up so that there are no complications. Usually, as there are no complications when you maintain it very well.
ओके देयर आर क्वेश्चंस ऑल्सो जो हमारे फॉलोअर्स पूछ रहे हैं मैं इसमें से भी एक दो क्वेश्चन आपसे ले लेती हूँ एक ने पूछा है हेलो मैम माय डॉटर इज 5 years एंड हैज डबल टीथ इन लोअर जॉ शुड आई हैव इट रिमूव्ड और लेट इट फॉल नेचुरली और शी व्हेन शी ग्रोज ओल्ड
True. A double teeth, as I told you, there is a milk teeth. Okay. Generally, when a permanent teeth comes out, it comes behind that milk teeth. Okay. So it will look like the kid is having double teeth. That is because the milk teeth is also there, the permanent teeth is also there. So I think they should visit the Clove Dental to a dentist to see and assess whether a removal is required or not. Depending upon that, we can treat the child.
ओके अच्छा one viewer is asking what should be done to remove child tooth if child tooth get cavity.
Yes. See, there are a few cases in which there is the cavity is extended to a stage where we need to remove the tooth. Okay, in that cases, there is something called a space maintainer. As I told you, the milk is followed by a permanent tooth. Okay, when the milk tooth is taken out, the remaining teeth will come into the space and you will not have space for that particular permanent tooth to come out. Understand? So what we do is something called as when we remove that tooth, we maintain that gap with the space maintainer. So the doctor will again see and assess. For which generally it's better to visit the clinic once so that we can assess because individual base is different. So now the parent can understand what has to be done. So it is nothing serious or something. Once they come, we can assess, diagnose, and give them the particular advice.
Okay, one more question is there. Is my child if my child loses teeth due to decay, what should we do?
Tooth decay. Yes, there are various levels in tooth decay. The decay can be in the level of the first layer, second layer, third layer. There are too many layers in a teeth. Okay, if it is in a primary level, a filling can be done. If it is extended, there is a treatment called root canal, which can be done in a kid also. Not necessarily root canal should be done in an adult. It can be even done in a child to save that tooth, to save that particular space where the permanent teeth will erupts. Okay, again, if we visit the clinic, we can tell which layer the tooth is in. We can make X-rays and finalize what treatment is necessary to decide.
Okay. Acha, listen, one person is asking, my kid teeth is very yellow. What I can do?
Yes, that is mainly because of the brushing. Okay, so they have to bring the child, we'll educate the child how to brush and how to maintain the teeth. Depending upon the yellowishness will go off. And also, if required, we need to do a cleaning, which is technically called as scaling, which will also help in changing the color.
Okay, one person is asking, what should we do? Child tooth break while playing at early stage, means child milk teeth tooth is broken.
Totally understandable. See, child generally tend to play a lot, get traumatized to the front teeth and all that, which is the panic situation for the parents. Generally, when it breaks or the entire tooth might also come out sometimes. We just have to save the tooth and visit the clinic which is nearby immediately. Sometimes we can actually reimplant the tooth, or sometimes we'll have to replace. That has to be taken a call, even after seeing the patient. So better you save the tooth and visit a clinic nearby. We have to even look for some injuries. So that also has to be seen.
So ये इंजरीज हमें कैसे पता चलेंगी कि एक्चुअली इंजरी हुई है या नहीं हुई? Because people avoid. If this happens, then people avoid to visit doctor.
Correct. So that is also necessary. They regularly, apart from all the injuries or any problems also, it is advisable to visit the dentist whether there is a problem or not a problem. It's better to have regular dental checkups because as a layman, we will not know many things about the teeth. So when you come to a dentist, they will educate what your eyes cannot see. So it is better to have a regular dental visit.
Okay, such a useful session. Everyone is, so excited, and many queries are also coming. One person is asking, ma'am, I have one more question. My gums are pink, but my daughter gums are blackish. Is it genetic, or when they will turn pink as she grows old? Gums are black. What?
Understandable. Actually, like how the human skin has something called as pigmentation, because of which there are black spots or something, the gum is also a part of it. So it is basically the pigmentation. It is a natural thing. If you want to change it, there are processes, but in a kid, I would advise not to intervene for now, but just have a checkup for the doctor to analyze whether it is normal pigmentation or something else.
ओके आई होप हमने सारी क्वायरीज कंप्लीट करी हुई हैं. लेट मी चेक इट वंस अगेन. एक क्वेश्चन और है, व्हाट विल हैपन इफ आई डोंट करेक्ट माय चाइल्ड्स इरेगुलर टीथ्स?
Sorry, it was interrupted. Can you repeat?
Yeah, sure. What will happen if I don't correct my child's irregular teeth?
Yes. See, if you don't correct it at an early stage, there will be requirement of removal of the teeth to correct it later. So it is better if you visit us as early as possible so that we can prevent the removal of it in future. So it is better to visit, as I already told you, regular follow-up covers everything.
ओके थैंक यू डॉक्टर फॉर क्लियरिंग ऑल द डाउट्स जो भी मेरे फॉलोअर्स को थे. आई होप ये सेशन बहुत यूजफुल रहा होगा इन लोगों के लिए, सभी के लिए एक्चुअली. और इस वीडियो को मैं डेफिनेटली शेयर करूंगी अपने फीड पर सो दैट ये आगे भी यूजफुल रहे हमारे व्यूअर्स के लिए. Let me check it once again. कुछ रह ना गया हो.
Definitely. And a small advice. People think that we should not bring a child before 6 years or 9 years. Just for an
Yeah.
understanding, the upper jaw grows only up to 9 to 10 years. If there is a problem with the upper jaw, if you bring the child post 9 or 10 years, it's very, very difficult to correct. So as I told you, the ideal age to bring a child 6 years, and from that time, regular follow-up is required. Sometimes, if you see, just for a normal, just for an awareness, I'm telling. Ideally, the upper teeth has to be in the front and the lower teeth has to be at the back. People think it should be square. No, the actual scenario is the upper teeth has to be in the front and the lower has to be at the back. If there is a reverse of that, or if there's some problem with the biting, they have to bring the child as early as possible so that we can correct it without going in for a surgery or removal of the tooth or anything. Just for
Okay.
awareness.
Achha, one more question from my side. What advice you can give to oral health के लिए, because लोगों को पता ही नहीं होता, they are not aware of things, little things, but they are very important.
Of course, yes. A regular brushing is the only way to maintain your tooth, okay? And it has to be done twice in a day, morning as well as night. And there is something called as a floss, which is mandatory for all the individuals to do, which we generally miss out. When you clean a tooth, we generally clean the front portion, back portion, and the top portion of the tooth, where the brush is accessible. There is also some surface of the tooth where the two tooth comes into contact, this portion. Okay, we don't clean that. Generally, we use a toothpaste or something when the food is stuck, which should be
Yes.
avoided. And we should use something called as a floss, which is available on YouTube, the instructions, everything. Just have a look at everything and the floss. By flossing, you can prevent cavities.
Okay. And
Yeah.
kids कौन से टूथ ब्रश यूज करना चाहिए, या कौन सा टूथपेस्ट इज बेटर?
Yes, there is a kids toothpaste available in the market. Kids brush also available in the market. Okay, until the permanent teeth erupt, we can brush with the kids toothpaste and the toothbrush. Once the permanent teeth starts erupting, you can shift it to adult toothpaste and adult brush.
Okay. Okay, doctor. So thank you for clearing all the doubts. It's a nice session. Thank you. Thank you for joining.
Thank you. Thanks a lot.
Yeah. Okay. Bye bye.
Bye.
Bye.